an infectious disease caused by a newly discovered virus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease and cancer are more likely to develop serious illnesses. The best way to prevent and slow own transmission is to be well informed about the COVID-19 virus, the disease it causes and how it spreads. It's crucial to protect ourselves and the people around us from the infection by washing hands or using alcohol-based rubs or sanitizers frequently, and it's suggested not to touch your face. Most of the countries are badly affected due to the coronavirus, including Malaysia. On the 8th of July, 2021, Malaysia reported 8,868 new COVID-19 cases, and it's also the country's second highest daily infection count since the start of the pandemic. More than half of the new infections were from the Klang Valley area, with 4,152 in Selangor and 1,133 in the capital of Kuala Lumpur. A further 897 cases were found in the neighboring state Negeri Sembilan. However, since Malaysia extended the total lockdown of people, many initiatives have been taken by the Malaysian government to lighten the burden of the Malaysian citizens. National Recovery Plan was introduced as a measure to help people and businesses. Malaysian Prime Minister introduced a blanket 6-month loan moratorium to contain the economic impact of a total lockdown that lasted nearly 3 months. The popular tourist spots that used to be crowded areas seemed very quiet and deserted. It's hard to see that most of the shop owners are suffering and lost and cannot earn their income. Schools are also closed for safety purposes, and online distance learning, ODL, is being conducted. Malaysia also received 14.4 million doses of COVID-19 vaccines in July, according to the COVID-19 Vaccine Supply Access Guarantee Special Committee, JKJAV. These, it said, comprise a total of 6.43 million doses of Pfizer vaccine from Pfizer as well as the donation from the US, 1.59 million doses of AstraZeneca delivery of AstraZeneca manufactured in Thailand and donation from Japan, and 6.38 million doses of Sinovac, from Pharmaniago and donation from China. Under the National COVID-19 Immunization Program, PIC, the country has thus far deployed shots manufactured by Pfizer, Sinovac and AstraZeneca. According to an ex-clinical guide, a few vaccine priority groups of people with underlying medical conditions were listed. People with HIV infection, asplenia or dysfunction of the spleen, chronic heart disease and vascular disease, liver disease, neurological disease, respiratory disease are not advised to take the vaccine. Apart from that, patients who suffer from diabetes mellitus, obesity, severe mental illness, or immunocompromised due to disease or treatment are advised not to take the COVID vaccine, leading to some medical issues.